Hi, I'm Tim Zacharias with Cougar USA and your host of Building Value. This is part 2 of a 2-part episode with Christoph Loh, Vice President of Strategic Initiatives with IAPMO. And on last episode, we covered the Water Demand Calculator and the Water Demand Calculator Summit that's coming up. And on this episode, we're going to shift gears a little bit and talk about hot water distribution systems in large buildings. So this has been a hot topic here lately, and really excited to kind of dive into some of the details and what Christoph's been working on in terms of education and guidelines around Legionella. On Building Value, we go behind the scenes of building operations to showcase the people and products that make buildings work and the value they bring to the community. I'd like to kind of pivot just a little bit, but at the same time continue our conversation from the water demand calculator over to that the hot water side of the plumbing system specifically. So to kind of continue on from the demand calculator and the diversity of use, all of that, I mean, we're seeing even more so on the hot water side of the building, the hot water demand being overestimated specifically out of the whole building. So I'm curious if that's going to be a part of the water demand calculator where it's kind of split out hot and cold, but definitely can have the same impact down the line when you're overestimating the hot water demand specifically. But you know, I joked with you the other day that this has been a quote unquote hot topic lately, and you know, I'm a sucker for dad jokes, so I got to get that one in there. But the hot and I like this term, which is one we've been using a lot too. The hot water distribution system, because it's a lot more than just a heater, right?
Yeah.
And so these are, you know, when we're talking about is large buildings with large hot water demands, hospitals, hotels, some multifamily can get into that, and high-rise condos, things like that can get in there, but not necessarily like a commercial office building. That's not really what we're, you know, it's a pretty simple system there. But when we're talking about hot water distribution systems in these buildings, it's been a lot of the focus for us recently has been not necessarily on the heater, right? It's the rest of the system where a lot of the issues can come from, and where some of the design headaches can be. So I know this is an area of expertise for you as well. So you can kind of give us just maybe a little short overview of your take on the hot water distribution systems, and then I'd love to pick your brain a little bit about your specific expertise from your classes.
Yeah. Fair enough. So on the hot water return, really it's a hot water return side thing. So I think there's a couple things that have happened over the last 80 years, especially, when you look at the industry, and especially as mechanical engineers started focusing more on HVAC and kind of, pushing the plumbing design off to non-engineers, shall we say. What really happened, especially on the hot water side, is that a lot of rules of thumb started occurring. Then as the rules of thumb were occurring on the design side, the same thing happened on the install side. And then after it happening on the install side, the maintenance side did the same thing. And then you had any kind of change and iteration to the system, and it just compounded on each other. That's what it is in a nutshell. So what does that mean if we dive into the details? So on the hot water design side, plumbing systems hot water return systems specifically are unique for two reasons. One is that they are sometimes an open system and sometimes a closed system.
Yep.
And then the other part of it is, the hot water return side, as opposed to hydronic heating or cooling system, does not return 100% of the flow. You're only returning enough flow to maintain temperature, the temperature you want in your system.
Yep.
And that's for cost reasons in many respects. So when the hot water return system is designed, really as your system goes, as you're routing your hot water supply, to all the fixtures, and as it reduces in size because of the flow rate to the fixture, your heat loss, or your heat loss on per node, basically per pipe length, will get smaller as your pipe diameter gets smaller. And that's just your basic heat transfer equation. Smaller surface area equates to less surface area equates to less heat loss, or less heat transfer, I should say. So that's the one thing that's working. So one of the general rules of thumb that had been out there for a long while that had been industry accepted was to utilize 30 BTU per hour per lineal foot. Now, when you look at and run the math, right, and you look at what that equates to from a mathematical standpoint, from using current insulation requirements, so inch, inch and a half, 2-inch, you're looking at about a 6-inch pipe. So you're assuming everything in your buildings on your hot water side is a 6-inch pipe. That's, again, gross oversizing. So that's part one of the problem is you're overdoing, that. Now, some ASPE does have a domestic heating water handbook. It's a great book, and they actually have a chart in there that breaks it down based on size. The only limit of that chart is it only applies to 120 degree Fahrenheit water. A lot of designs now are starting to push higher temperatures.
Yep.
Plus the insulation thickness, that chart was based on 1 inch thick insulation. The latest energy conservation requirements are looking at 1.5 or 2-inch thick insulation. So now some of the heat transfer is decreasing, and it's the temperature is making it bigger, the bigger heat transfer, but the insulation is making it smaller. So you have to go through and do the calculation. We've done that on the ASPE side. I work with the ASPE Legionella Design Working Group, and hopefully early 2022 we'll have a guideline release for public comment that will have those charts in part of it. And I've been teaching on this subject and hope to teach on it more to ASPE chapters or anybody else that's really interested in it. So that's part one of the problem. But the other part of the problem is actually where really we've kind of had the bigger issue, and that is on the control of the system. And
it's a major issue.
It's a major issue. And it sounds like you're familiar with this, and maybe you want to share some more stories here. But we've been utilizing manual balancing valves that have a CV value, not a GPM, but a CV value on the side. There's a whole calculation where it's like CV equals, I think it's the square root of the change in pressure over the change in GPM or over the GPM. Basically what it's saying is that there's some kind of relationship between change in pressure and your GPM.
Yep. And
the CV value that you're dialing your valve in changes it. The problem with those types of valves is there's kind of a couple of challenges that come into play. If you don't go through, so as you balance one valve, so you have that change in pressure, and if you have multiple valves, if you change that pressure in one location, it changes all the other ones. Because in essence, you're creating an artificial pressure drop. And so what's needed is when you have a system of like 3 loops, you have an A balancing valve, a B balancing valve, and a C balancing valve in parallel loops. And if you change A, you get it where you want to. It's the closest one, and C is the furthest. If you go and change B, you have to go back and change A, and you go bouncing back and forth between A and B until you get both of them roughly where you want them to be. Yep. Then you go to C, and as you change C, it impacts D, and now you have to do C and D, and then you have to go back and do A, B, and then you have to go back and you have to go multiple iterations, A, B, C, D, A, B, C, D, A, B, C, D, and you have to have that happen. Now, I will say as an engineer on the consulting side, I asked that report of that occurrence is given to me on every project. I can count on one hand once that I actually got the report.
Yeah, that
was early in my career.
That doesn't happen as much on the domestic hot water on the manual balancing valves, like it would to that extent, like on a hydronic loop.
Yep. And the problem is when the system is unbalanced like that, you can start having hot water delivery issues. You can start having waterborne pathogen growth, and that is something that I have seen, through my experience. In a brand new, state-of-the-art, world-class hospital, they had issues. And it was in a large urban area, multi-story. I mean, this was probably like a 20-story hospital. And they had Legionella cases because the hot water return system wasn't balanced. They had utilized that older valve, or that type of valve, and it wasn't properly balanced. If you balance the valve, it's great. There's no problem there, but it doesn't happen. And that's where we've had this whole line of automatic balancing valves, whether they're pressure independent. Oh, yeah, go ahead.
Yeah, I would say even if you do get them balanced at commissioning, that's only at that flow condition. Right? I mean, these are dynamic systems, so it's almost impossible
open to close. Yep.
for the manual balancing valves to ever be properly balanced.
Well, I mean, it'd be tough. I don't know if I can say one or the other. I would say, generally speaking, again, the plumbing systems are going to be closed state, And when you have a fixture that's open at the end of the line, you're going to be drawing more water through there. But I could see an argument, and I think it needs further study about how it would actually react in a live building. But the other thing that I see
the other problem is you're also assuming that valve is going to stay in the same spot as the way that the guy left it that did the commissioning, right? Somebody else is going to come by and be like, why is this valve a quarter of the way closed? I'm going to go ahead and open that up. It should be open all the way. And then there goes all the balancing, right?
Very true. Very true. And I would say, I mean, certain building types, like especially healthcare facilities, I mean, they start their first renovation project the day after construction on the bed towers.
Yeah.
So I can say, I mean, this is one of those things that I didn't think of until later. Early in my career, I certainly didn't think of it, is any building that undergoes renovation, they really should do a pre and post rebalance if they're utilizing that type of manual valve on the entire system. And they should go back and make sure that the circulation pump is properly sized, because it may or may not have capacity. And that will all impact that. They should evaluate the hot water return sizes for the same thing. That's the guidance that we're starting to come out with in the industry. I think you'll see that kind of a requirement in the ASPE Legionella design guide, because we're starting to kind of hit on that and understand that. But it's a big problem.
Yeah.
So that's
and I didn't mean to jump in and cut you off on the automatic flow balancing or temperature balancing valves, but that's definitely the way that we recommend, and I'm sure that's where you're going with this is that those are the preferred method of balancing these loops.
Well, there's certain advantages, from an automatic over a manual. Again, I think that my sense is that the industry is going towards the automatic balancing valves in lieu of manual. I think, again, either one is doable if you follow the right criteria. But my sense is the industry is starting to gravitate towards automatic balancing valves because of the lower concerns on the back end and kind of having a little bit some redundancy, if you will, some good redundancy built into it. And when we talk about automatic balancing valves, I generally categorize them into one of three categories. One is pressure independent, so where you have a cartridge that maintains a given flow rate and will change the pressure to maintain that flow rate. And there's both cartridge type, so a fixed type, and an adjustable type. I'm aware now of some adjustable types coming out where you can actually dial it in. And the plate is a GPM. It's not a CV value. So I think we're starting to see that. There's thermostatic balancing valves, those that will modulate flow and flow and pressure to maintain a certain temperature. And those are also in a fixed cartridge type or manual, the adjustable type. And then finally, we have the electronic type, and that's the newest type to the market for plumbing. And that's really, I'm seeing some of the biggest changes in plumbing is anything digitalization, electronification of plumbing systems, which I think is so incredible, where you see electronic controls to control for either temperature, flow, or head, and you have total control of the system to maintain it, and you can modulate it and track the data on it. And that's my sense, especially because of some of the concerns of Legionella. And I think we'll see those types of the electronic type being more popular, more likely than not in healthcare first, maybe in some hotels and hospitality. But I think especially in healthcare, maybe. I think healthcare.
I think it's going to be cost prohibitive in some of those markets, but I could see healthcare doing it.
Yeah, it might be, but it might not be. I mean, when you look at the number of Legionnaires' disease cases, the health hospitality, the number of cases and the number of lawsuits is right up there with hospitality. And so you start looking at the insurance providers and how they're reacting, and they're charging higher, in essence, premiums for those facilities that don't have a water management program or aren't doing something active about it. It might actually become cost inhibitive, or the cost may actually work out for it. It might be worth them to put an electronic in, just from complying with what the insurance carriers. It's going to be something we need to keep an eye on as an industry. But I think you're right. I think the healthcare likely is going to be the earliest adopters, and it's probably from a cost standpoint, it makes the most sense, especially with the populations there that are most at risk. But either way, I think whether you're talking any type of automatic balancing valve, my sense is that especially for those types of markets, we're going to see a trend over the next 10 years, especially towards those types of devices, and especially for any building that has water management criteria or water management programs, I should say. I think anything that allows for the automatic data collection to be able to prove out in a court of law that they were trying to follow, that they were trying to follow this and that they were doing something active. I think that's going to really be, and I think automatic valves with sensors on them, or automatic valves are sold and then the sensors are added aftermarket. I think those are all the trends we're going to see here in the next 10 years, and we're going to see more and more movement on it. I don't think it'll be widespread adoption. I think there's always going to be a need for all the different types of valves, but that's really that systems level thinking that we're going to start to see, and I think you'll start to see it in our codes and standards too. That the need for that kind of evaluation of products, evaluation of the systems, and looking at it from a systems-based approach. And then what are the code requirements, responding to making sure that the system's safe, and that it's positively there for public health.
Yeah, and I think we're kind of back to that argument of that push and pull of safety versus energy savings on these hot water systems. And you look at all the different kind of guidelines and codes and standards that touch a hot water system. I mean, you have ASHRAE 90.1 more towards the energy saving side, not running the return pump all the time, maybe generating to a lower temperature. You've got the ASHRAE 188 guideline 12 that's more conservative towards the safety and having a multi-layer approach, maybe adding some other water quality things to address the potential for bacteria. You have OSHA tech manual, I believe. I forget the actual chapter and everything, but it's saying more generates at the higher temperature, circulating constantly. And you got different ASSE standards for water heaters and for mixing stations, right? The electronic and thermostatic mixing valves, and then your points of use, the different. I guess they are technically mixing valves, but more the anti-scald valves at the points of use, things like that. So you have all these competing standards and codes all kind of overlapping into the hot water system. And so we've been trying to kind of navigate all of those and saying, hey, here's all the information, here's some maybe recommendations on ways to go. But I'm curious in from your side, from the IAPMO side, what of all of those, where's the design kind of going when we talk about that push and pull of safety and energy savings?
I think that and I wouldn't necessarily put it on the design, but I put it kind of more bigger picture for the plumbing industry.
Sure.
My sense is that there's a real push towards resiliency. And to me, resiliency, when we talk about building resiliency, a lot of times we talk about a hurricane, right? Disaster mitigation, or prevention. So we talk about, coming back after a hurricane hits or a tornado. But when we talk about water, plumbing resiliency, specifically, it's much deeper than just that. Yes, that's important, and other things are too. So, for instance, we have slow-moving disasters we have to worry about. Droughts, things that'll impact actually being able to utilize water. So there's a whole host of sustainability things. So we have disaster mitigation, prevention. We have sustainability. We also have water safety, right? As we found out, if we just pull on one side of this, if we just worry about sustainability, then the water quality could suffer, and water safety. But then we also have to remember that we need to worry about affordability too, right? And equity.
And performance, really. Right? Like people,
and performance.
When they turn on the tap, they don't want to wait 10 minutes for hot water, right?
Yeah.
So, I mean, that's part of it.
Well, and that to me kind of comes from water safety, water quality, performance. But I also think the affordability side of things is really important. I mean, we have people in the U.S. that can't afford water. You look at Flint, Michigan. In many ways, the entirety of what happened in Flint, Michigan, with the lead outbreak and then the Legionnaire's disease cases, that was as a result of really bad, unfair practices where you have a city that's getting smaller and smaller, and there's just not enough money to really do the right thing for the plumbing system. Right. And so we need to be mindful how these things that we're doing, these solutions that we're putting out there, how they're thinking through it. And so the water demand calculator, I think, is one of them. Doing hot water return size is another one of those things. If we can go through and look at, instead of using rules of thumb and maybe less than ideal practices in implementation, if we can make our pipe sizes smaller, if we have the systems automatically balanced, we can save a cost on the install. We can make the system more affordable. We can use less materials. So there's sustainability. We can use less water. Especially on the operations standpoint, we can go with with more efficient systems and still improve performance, and have something that maybe during a disaster can maintain, like the COVID pandemic, where the building shut down, it can still operate and do so in a safe manner. So to prevent potential, public health and safety concerns later on. So those solutions are happening, and we're looking at them. And these are the concepts I think that IAPMO as a whole that we're really focused on trying to provide solutions, to the U.S. And some of them are ones that a lot of people aren't entirely aware of. And so, on our end, then there's that education standpoint, and that's what IAPMO is all about. Is making sure that we get the message out there and that we're leading on that forefront.
Yep.
Which I believe we are.
Yeah. No, I would agree with that. I mean, and I think hot water systems are definitely one of those situations where an ounce of prevention is worth a pound of cure, right?
Very much so.
I mean, and it's not like these things that you're talking about for these small kind of design changes to either right size your pipe or change from a manual to an automatic balancing valve or a smart return pump, things like variable speed, other integral electronics, things like that. They're not it's not going to affect the affordability of the project. Right?
No,
actually,
well,
in some cases it could improve it, right?
And I think that's it.
Pipe size, so
yeah, well, and you can do that, but you got to think about it holistically, right? If there's no good in making the project more affordable in the short term, if in the long term it's going to cost you more, you want both, and there's ways to do it, and that's what we're looking at IAPMO. So I think for places like in Texas, I think Austin and Houston, right, are two cities that have the Uniform Plumbing Code. I think you can very much go to bed feeling that you have an organization that's working on your behalf, that's not just resting on its laurels, but that's looking for the next innovation to keep the systems getting better and better and looking at it holistically. And there's a great opportunity to kind of have a code and a group and an organization that's there for you that is helping to shape the industry and working with the industry and working with people outside the industry too. To making sure that our plumbing systems are safe, reliable, resilient, and that they're promoting public health.
Yeah, and you're blocking it right now, but for the health of the nation, right? I mean, that's I always love going back to that image. But I mean, it's true though, right? I mean, I think that's one of those things that people don't necessarily when they think plumbing, they don't necessarily connect it directly to public health and safety, but the two are very closely tied.
Very closely tied. Yeah, the poster it's a very famous one from I think the 1950s. The plumber protects the health and safety of the nation. And it's interesting. I would probably give it a refresh now, and I'd say the plumbing industry protects the health and safety of the world because we're expanding well beyond the borders of the U.S. And that's not just IAPMO. That's everyone in the industry. We're really starting to pull together and bring clean water and sanitation to the world. But it definitely starts here at home. And I think that's where the work that we're doing, I think, really sets things up very nicely for those folks that utilize our code. And there's always opportunities to adopt and take provisions and utilize them in various jurisdictions too. So, lots of great opportunities here moving forward. I'm very excited about the next 10 years. I think IAPMO's on a fantastic track. We have some great folks, really smart, capable people in-house and some great and amazing volunteers. And I'm certainly excited to be working with all those folks here moving forward over the next several years.
Yep. No, that's awesome. And, definitely looking forward to, like I said, the Water Demand Calculator Summit coming up here in November, right? Early November.
Yep.
And you said already can use it on the website to go and use the Water Demand Calculator on the IAPMO website. If people wanted to find more information about the hot water system design that we touched on a little bit there, what's the best way to get that information?
I would say if they want to reach out to me, they can. If you want to connect with me on social media, I'm at Lohr Thoughts, LOHR Thoughts, or you can connect with me on LinkedIn, Christoph Loh, PE, or shoot me an email, christoph.lohr@iapmo.org. Right now I give those classes regularly. That will be released, I think, as part of the ASPE Legionella Design Guide. Basically I was the one that kind of worked on creating it and then, donated it to ASPE. So there's going to be, but I give a training class and have been giving training classes over the last year-ish to kind of talk about that methodology. But otherwise, if you're interested in the Water Demand Calculator Summit, you can also, you might hear a little bit on that. But that'll be, again, November 4th. If that web page, for instance, that web page, if folks are interested in it, is WDC, so Water Demand Calculator Summit, summit.iapmo.org. That's where you can go and register. Awesome. You can see our program schedule as well. But if they're interested in learning more about the hot water side, just have them reach out to me. And if it's an organization, if it's an individual, I'm a firm believer in teaching and learning. And as a result, I definitely spend a lot of time with folks individually and in groups to kind of help them understand what I've learned. So
yeah, no, that's great. And I think you obviously are very passionate about the plumbing industry, and that shows with the work that you're doing, and we appreciate that, and helping push the plumbing industry forward. And I'm looking forward to the WDC Summit for sure, and definitely want to pick your brain some more on the hot water systems, because that's definitely something we've been diving into, and a lot of times it's been after the fact trying to get systems to work. So I'm definitely interested in getting a little bit more of that prevention in there, working on those designs. So, no. But I definitely enjoyed having you on the podcast today. Appreciate your time and your efforts with moving the plumbing industry forward.
My pleasure, Tim, and would be happy to have the conversation and continue the conversation with you anytime.
Absolutely. Well, any final words of wisdom for our listeners here, or anything that you think of as you look back on your career?
Final words. I would say the big thing I think for folks, when it comes to plumbing, is to realize, there's this great quote by the American Water Works Association CEO, David LaFrance, that says, people think water is simple, but it's highly complex. And I think what my final word would be is I'll take that quote and I'll modify it and then give it to myself. And that is, people think that plumbing is simple, but it is highly complex. And I would extend it to all of plumbing. And I think this is important because, when you're looking at codes and standards, when you're looking at implementation, when you're looking at design, when you're looking at manufacturing, sales, install, all the rest of it, there's a real importance to have the industry of plumbing involved, because they understand the nuances, and not just involved, but to be, to have their voice heard in the development of guidance for the industry and codes. That includes codes and standards. So sure. I would encourage your listeners, to definitely be mindful of that, in terms of codes and standards. The Uniform Plumbing Code is a code, it's an ANSI process. It's something that we have the various stakeholders of the plumbing industry, that are, diversely and proportionally involved in that standard and the code development. And that's a really important part. So you want to have that expertise to making sure that you come up with those holistic solutions. So that'd be my last word, I'd say.
Absolutely. That's awesome. Well, again, appreciate you coming on the show, sir, and look forward to continuing the conversation.
Likewise, Tim. Take care, sir.
Awesome. And also want to thank all of you for watching and listening today on this episode of Building Value, and hope to see you on the next one.